So Melissa wants to hear and understand how to help her clients understand how we work together to care for people across birth settings, yeah? And how we're different from the United States. All right, well, why don't I start with having Karen and Brenda address some of how it is here, and then I can tell you a little bit about how it is in the United States.
Okay, one of the wonderful things about BC, and we're actually the envy of many jurisdictions in the world, is that we have managed to create a very collaborative system for midwifery, family doctors, and obstetricians. So that if someone is planning a home birth and they need to transfer to hospital, we have a system in place where transfer occurs smoothly, transfer of information, transfer of the mother, transfer of the baby, whatever needs to happen can take place, and the care providers fairly seamlessly help each other out. And I don't know how we managed to do it, but in a short period of time since midwifery has been implemented in British Columbia, that is actually the case in almost all parts of BC.
I think we're unusual in that 2 of the 4 of us that are up here have worked in the U.S. medical system. I went to medical school in the States and did my internship there, and it is a very different system. We don't, I think, see the same degree of collaborative relationships in the United States as we do in Canada. I was actually quite taken aback last year when I went to a NIH consensus conference. There was a team of us that were sort of there together, a nurse, 2 obstetricians, and a midwife. And we were quite taken aback by the adversarial relationship that there obviously existed between midwifery and obstetrics. And I would say that in Canada, even though some of my colleagues may not be as comfortable with midwifery as I am, and I'm so comfortable with midwifery that I actually look at my patients, and if they're low risk, say, do you really want to see me, or would you like to see a midwife? And so that's maybe a little bit further than some of my colleagues have gone yet, but I do believe that there's a lot of interprofessional respect for different professions and what they know and what they do. And that's very different than sometimes in the United States, where the professions actually practice very separately from each other, and where the feeling of obstetricians towards midwifery and home birth is a lot more adversarial than it is here in Canada. I do think that it's really worthwhile for women to find a provider that has that collaborative approach. And I would say that most of the midwives that I have met have that, but I don't believe that all of them do. I think it's high, though. Many of the family doctors, depends on the hospital that you work at, actually. I think Karen works at BC Women's, and there's quite a good collaborative relationship between the departments, but I think at some departments it's growing, but maybe not as high as it is at BC Women's. And I think the obstetricians are probably a little bit of the laggards when it comes to being collaborative, but I think in general specialists probably have a little bit more to learn about that than primary care providers, because by the nature of your work, when you're a primary care provider, you have to collaborate with specialists. But as specialists, you don't always have to collaborate as well with primary care providers. I do think, though, that from a healthcare planning perspective, so when we're talking about planning care for women in Fraser Health in particular, we are always talking about collaboration, and we are always looking at how we can improve that collaboration between healthcare providers. It's high on our priority list, and I would say that that's very different than in the United States, where that is, I have not seen evidence of that being a high priority for other people.
Midwifery in Canada is quite young. In Ontario, it's only been, it was only regulated about 17 years ago, I believe. Here it's been 12 years. Am I getting yeah, it's about, yeah, something like that. Well, 1998, right? Was, yeah, 1998 was when in BC it became regulated, and getting regulation didn't mean that immediately you had people who could practice within the system, because there was an integration period. Many of the midwives who were here before, some of them were empirically trained or they trained each other through apprenticeship programs. Some of them went to other jurisdictions to get training. Some of them came with degrees and qualifications from other countries, but couldn't practice here. Once they got regulation, there was an integration period because midwives are mandated to offer birth at both home and hospital. And in fact, we practice in both settings. We're the only profession right now who offer both settings. Very recently, for a while, home birth was a very controversial subject. It continues to be, and we shouldn't, I think, feel very, although things are very organized in a nice way at BC Women's and in Vancouver and at Royal Columbian and to some degree even at Burnaby Hospital and the Abbotsford Hospital. There are midwives and physicians and good working relationships. That's not true in the rest of BC. In fact, in many places in BC, there aren't any maternity providers, much less midwives. We don't have midwives in some of those areas. We don't have family doctors. We may have a single family doctor who can't possibly handle the volume or really be on call 24/7. So the health human resource planning that we need to do province-wide is quite different than what you might experience here in the urban setting or the suburban setting. Having said that, for those of you who are here and thinking about your options, the model that we create here and the respectful relationships is what we're hoping will be replicated in settings where women don't have access to care. And that's based on the research. So